I'm Dr. Levine. I wanted to help you today figure out how to succeed giving your injections for FIP infection for cats. So these are daily injections, sometimes they're even twice a day. They can be quite painful. They can cause sore areas on the skin. They can even cause actual sores themselves. And so we want to make sure that we're giving them in different spots each day and trying to give various areas on the skin time to recover before they get re-injected. And so we're going to be using a few different things to help us do that. One is just actually relying on medicine. So asking your veterinarian for something like gabapentin, which is a nice pain medicine, and maybe not even adequate a painkiller as maybe something like a lightweight opioid like buprenorphine that we can give a couple hours before we give the injection to see if we can help cover the pain of it. So as usual, we're always trying to make this a better experience with treats. You can use Churu, you can use Little Temptations, you can use Crunchies, you can bring out the laser pointer, you can be trying to massage these acupressure points that we know are soothing for these cats to try and have as good an experience as possible. So when we're doing these injections, we try not to do them in high mobility places, so there's less soreness, less pain afterward, but you need to be pretty deft and pretty quick at it. And so what the Common Cozy Cat Wrap allows is that when the cat has a reaction, which it's likely going to, that it hurts, and so it's going to want to try and get away from you, but you're new to giving injections and you want to do this, get all of the medicine in and not waste any of it, because obviously it's vital to the success of treatment, that you have all of these access points. So you can bring back this swaddle, this Velcro can move up or back, and now you can access these various areas on the cat. So I do think in the beginning it is important to clip an area. You can get these clippers, they're on Amazon, they're actually pretty cheap, less than $20, they're pretty quiet. I think it's important to clip a spot so that you can see your needle actually going into the fur, because you don't want to give this important medicine into the fur and miss the actual treatment. So you can pick up skin here on day one, say you want to do it here. Day two, you can move to the other side, go down to the left side of the shoulder, or you can move this whole swaddle forward. So you'd zip it back up, move it forward, and then you can approach from the hind zipper and you can get access. Now, some cats are a little more sensitive in the hind end, but you can get access to the side of the abdomen. This is a little bit of a shorter cat, but you can get side to the abdomen. Anywhere where you can pick up skin, you can give the injection. Alternatively, if you want, you can put the cat on its side and you can access various other spots. So there's this zipper that you can get to the side of a leg, or you can get to the side of the chest if you want to go through the hole where this leg would be. So anywhere where you can lift up the skin, you can get the injection in. So poking through the skin, I think it's nice to try with a ripe avocado. The actual action of poking through the skin, the resistance of the skin itself, and then how smooth it is on the other side is just like going through an avocado. Because once you get through the first point with the very tip of your needle, it kind of sinks in nicely. And you can feel that same texture going into the cat's skin. And so you want to know that needle is nicely placed before you start injecting. So over the course of 3 months, there are so many access points where you can get to your cat's pocketed areas where you can pick up skin. And again, relying on medicine, relying on treats, relying on pheromones, anything you can to make this a better experience. Having anyone in front of them, if you can have a second set of hands, to sort of just help soothe this cat. That's going to be a better experience and a better success.